Robert F. Kennedy, Jr. And Mr. Kennedy, Mr. Secretary, you may make your opening statement at this time.
Thank you, Chairman Crapo, and thank you, Ranking Member Wyden, for the invitation to appear before the committee today. Before I summarize what we've accomplished this year at HHS, I want to express my deepest condolence to the family of DeKalb County Police Officer David Rose, who gave his life to stop the gunfire attack on the CDC on August 8th. Officer Rose was a veteran. He was a husband and the father of 2 children. Officer Rose's widow, whom I visited, is expecting their 3rd child. I'd like Officer Rose's family to know that he remains in our prayers and that he will continue to be in our thoughts. Let me start with the big picture. Under President Trump's leadership, we at HHS are enacting a once-in-a-generation shift from a sick care system to a true healthcare system that tackles the root causes of chronic disease. Chronic disease has reached crisis proportions in our country. And finally, we have an administration that is taking action. The Maha Report assessment, which the White House released in May, was the first government analysis of the key drivers of childhood chronic disease: ultra-processed foods, chemical exposures, physical inactivity, and over-medicalization. This month, we will follow with the Maha Report strategy, the Trump administration's solution for addressing each cause. At HHS, we haven't just been writing reports. We have been the busiest, most proactive administration in HHS history. In just half a year, we've taken on food dyes, baby formula contamination, the grass loophole, fluoride in our drinking water, gas station heroin, electronic cigarettes, drug prices, prior authorization, information blocking.
The committee will come to order. I apologize to you for that outburst, Secretary Kennedy. I would notify everyone else in the audience. Comments from the audience are inappropriate. If there are any further disruptions, the committee will recess until the police can restore order. Mr. Secretary, please proceed.
As I was saying, prior authorization, information blocking, and healthcare interoperability. We're ending gain-of-function research, child mutilation, and reducing animal testing. We are addressing cell phone use in schools, excessive screen time for youth, the lack of nutrition education in our medical schools, sickle cell anemia, hepatitis C, the East Palestine chemical spill, and many, many others. At FDA, we are now on track to approve more drugs this year than at any time in history. I'm also proud to say that HHS under President Trump is doing more with less. We have taken measures to fight waste, fraud, and abuse. Just by eliminating duplicative enrollments in CMS, we are saving taxpayers $14 billion a year. Meanwhile, we are expanding access for people who need it. We are ending racist diversity, equity, and inclusion practices and instead focusing on aiding low-income and vulnerable families, regardless of their race, which was the original intent of Title X. We're also pouring $1 billion into Head Start and the Administration for Children and Families. Compassion need not be the casualty of efficiency. I'd like to highlight some issues that have not gotten media attention. First, we are doing our part to fulfill the President's commitment to stop human trafficking, especially of children. We inherited a terrible humanitarian crisis from the previous administration with its open border policies, which allowed the appalling loss of 476,000 unaccompanied children. We have implemented policies now to ensure that that appalling tragedy can never happen again. We have knocked on 82,000 doors and located 22,000 of those children. I promise you that we will do more in the next 3 years. We are also addressing the disastrous health conditions in tribal communities on Native American reservations. I've met face-to-face with tribal leaders in dozens of communities and tribes in Alaska, Arizona, Idaho, New Mexico, and elsewhere. And I look forward to making HHS resources more available to those communities. One of the most significant initiatives under President Trump is the Rural Health Transformation Fund, part of the president's big, beautiful bill, which will provide the greatest investment of federal money into rural health care in history. Finally, I would like to address the recent shakeups at CDC. These changes were absolutely necessary adjustments to restore the agency to its role as the world's gold standard public health agency with the central mission of protecting Americans from infectious disease. CDC failed that responsibility miserably during COVID, when its disastrous and nonsensical policies destroyed small businesses, violated civil liberties, closed our schools, caused generational damage in doing so, massed infants with no science, and heightened economic inequality. And yet all those oppressive and unscientific interventions failed to do anything about the disease itself. America is home to 4.2% of the world's population, yet we had nearly 20% of the COVID deaths. We literally did worse than any country in the world. And the people at CDC who oversaw that process, who put masks on our children, who closed our schools, are the people who will be leaving. And that's why we need bold, competent, and creative new leadership at CDC. People able and willing to chart a new course. As my father once said, progress is a nice word, but change is its motivator, and change has its enemies. That's why we need new blood at CDC. That's also why it's imperative that we remove officials with conflicts of interest and catastrophically bad judgment and political agendas. We need unbiased, politics-free, transparent, evidence-based science in the public interest. Those are the guiding principles behind the changes at the CDC, and that is what you can expect all across our agency for the next 3 years.
Thank you very much, Mr. Secretary. I'll begin with the questioning. And one of the first things I'd like to talk to you about is actually something that is under the auspices of CMS. And I spoke with Dr. Oz last night about this. I'm sure you're very familiar with it, though. And that is that in the One Big Beautiful Bill, there's a lot of attacks right now going on publicly about hospitals are in trouble. And the blame for that is placed on the bill, even though the bill hasn't even been implemented yet. The fact is this committee held hearings on the troubles that rural hospitals are facing in the United States before the passage of the One Big Beautiful Bill. They've been facing difficulties in rural America for a number of years now. And the bill, the One Big Beautiful Bill, contained a rural health transformation program, which I would just like to ask you to comment on. This is the program which allocated $50 billion over the next 5 years to our rural community hospitals in the United States to help them deal with some of the financial crises that they are facing and transition to more stability. Could you comment on that program that is in the One Big Beautiful Bill?
Yeah, Senator, one of President Trump's campaign promises and one of the principal preoccupations, not only of Republican senators when I did my confirmation hearing, but also almost equally among Democratic senators, with the crisis in rural health. We've had 120 rural hospitals close over the past 10 years. These institutions are not just delivering health access to rural Americans, but they are economic centers, they are cultural centers for those communities. They are often the largest employer. They are the highest paying jobs, and they are the centerpiece for those communities. So when they die, the communities collapse. And President Trump promised to do something about that, and he has delivered on that promise. Right now, we spend about 6% of Medicaid funding is sent to rural hospitals, a very, very tiny slice, and that's one of the reasons they're in trouble. President Trump has now allocated through the One Big Beautiful Bill $50 billion, so $10 billion a year over the next 5 years. What we give to rural hospitals, that 6% represents $19 billion a year. So we're increasing that by $10 billion. So we're infusing more than 50% increase in the amount of money that is going to rural communities over the next 5 years. There's never been anything like that in history. It is the biggest investment, and it should stem this hemorrhage.
Well, thank you. I appreciate your giving clarity to that, because it is frustrating to see these continuous allegations that the difficulties that our rural hospitals are facing all were created in the last few months when we passed a bill, when we've been holding hearings in this committee about these problems. And in the bill that we passed, we gave a $50 billion boost to, as you indicated, increase by 50% the federal support for our community rural hospitals in the United States. And I think that the hospital owners understand that. They recognize this support. In fact, they are coming they're coming together very carefully with Dr. Oz to work on the rollout of this program so that we can see this boost and this support that is coming. Just another one of the disagreements we have about what really was in the One Big Beautiful Bill. So I appreciate you commenting on that. In the last minute and 10 seconds that I have with you, could you just quickly talk once again about the broad issue of making America healthy again in terms of our aim to change the healthcare system's focus from a reactive symptom management model to one that focuses on lifestyle choices and the root causes of chronic disease?
Yes, Senator, you know, this morning I got the latest numbers from CDC that 76.4% of Americans now have a chronic disease. This is stunning. When my uncle was president, it was 11%. 1950, it was 3%. Today, it's 76.4%. 8 out of 10 of our kids cannot qualify for military service. This is a national security issue. When my uncle was president, we spent $0 on chronic disease. Today, we spend $1.3 trillion. It's the biggest cause, and it's increasing. And all of the arguments that Republicans and Democrats have about single payer, Obamacare, or the various ways to allocate the health dollars, they're all like rearranging deck chairs on the Titanic. If we don't end this chronic disease, we are the sickest country in the world. That's why we have to fire people at CDC. They did not do their job. This was their job to keep us healthy.
Thank you,
and I need to fire some of those people to make sure this doesn't happen again.
Thank you, Mr. Secretary. I have to cut myself off to make sure I keep to this time frame too. Senator White.
Thank you very much, Mr. Chairman. I've made it clear I think that Secretary Kennedy is dead set on making it harder for children to get vaccines and that kids are going to die because of it. And Mr. Chairman, I'd like to put in the record today an op-ed written by Susan Monarez, who was fired by Mr. Kennedy.
Without objection.
So what we know, and Dr. Monarez, you know, was approved by Republicans. She wrote an op-ed today in the Wall Street Journal, which I've just put in the record, and I quote her. She said, "I was told to pre-approve the recommendations of a vaccine advisory panel newly filled with people who have publicly expressed anti-vaccine rhetoric." So this is not some liberal philosopher or something. This is the CDC director who tells the Wall Street Journal, which is not exactly interested in progressive, you know, theories and the like, that she was told to pre-approve the recommendations of a vaccine advisory panel filled with people who've publicly expressed anti-vaccine rhetoric. So my first question, Mr. Secretary, is did you in fact do what Director Monarez said you did, which is tell her to just go along with vaccine recommendations even if she didn't think such recommendations aligned with scientific evidence? That is
no, I did not.
That's a yes or no. So you have an opportunity to call her a liar if you say that you didn't do it, but I'd like to see you respond to this.
No, I did not say that to her. And I never had a private meeting with her. So there are witnesses to every meeting that we have, and all of those witnesses will say, I never said that.
So she's lying today to the American people in the Wall Street Journal?
Yes, sir.
Okay. Let's talk now about what's coming up, because I've made it clear what I've thought about the 203 days with my colleague, Senator Also Brooks. In 2 weeks, CDC's Advisory Committee on Immunization Practices will meet to make decisions about critical vaccines that protect us against hepatitis B, measles, and more. The committee's got a profound impact on vaccine access, but these aren't ordinary meetings. You've stacked the deck to ensure the panel bends to your views. In June, you fired all 17 committee members who are respected scientists and doctors. You replaced them with non-experts, vaccine skeptics, and conspiracy theorists. As a result, this critical advisory panel has lost scientific credibility. After years, colleagues, we spend so much time not looking at this as Democrats and Republicans, but as good science and scientific credibility. And now the American Academy of Pediatrics has warned that the committee is being politicized at the expense of children's health. American Academy of Pediatrics, you think they're lying too?
I think the American Academy of Pediatrics is gravely conflicted. They get, their biggest contributors are the 4 largest vaccine makers. They run a journal, Pediatrics, which they make a lot of money on, that is completely dependent on pharmaceutical companies. So I wouldn't put a big stake in what they say that benefits pharmaceutical interests. Senator, I didn't politicize ACIP, I depoliticized it. The Congress has been investigating ACIP.
All over the country, Mr. Secretary, scientists and doctors are saying otherwise. They're all wrong too. They're all lying, according to you.
The scientists and doctors are supporting me all over the country. There is division on opinion.
I don't get letters from thousands of people who are not political saying that this set of changes is going to damage American healthcare, and particularly these healthcare agencies, for decades to come. I don't get any letters from people saying, hey, this is going to make a big difference forever.
Yeah, maybe you're listening to a selective group of people.
Well, you get me.
Yeah, and I will.
Fine.
I will tell you what, Senator. I will put my mailbag against your mailbag any day of the week.
I got 30 seconds. Dangerous respiratory viruses like RSV are on the agenda for the next advisory meeting. Countless parents have been awakened in the dead of night by a wheezing kid gasping for air, forced to rush their little one to the ER. There's no worse heart-wrenching fear. The RSV vaccine offers these kids protection against the worst effects of the virus. But now it looks like you're on a crusade to make infants and babies more vulnerable to the terrible illness. That's what we're doing with the COVID changes.
And please make your answer brief, Mr. Secretary.
I've said that
the position is indefensible. I think it's possible.
Congress has been investigating that committee for 23 years because it is pervaded with conflicts of interest. What we did is we got rid of the conflicts of interest and we depoliticized it and put great scientists on it from a very diverse group.
Let me close with
very pro-vaccine.
Let me close with this, because like Senator Crapo, I'm a few seconds over. I don't think, Mr. Secretary, this is about you and me. This is about kids being pushed in harm's way by reckless and repeated decisions to get scientists and doctors out of the way and allow conspiracy theories to dictate this country's health policy. I don't see any evidence that you have any regrets about anything you've done or plans to change it. And my last comment is, I hope that you will tell the American people how many preventable child deaths are an acceptable sacrifice for enacting an agenda that I think is fundamentally cruel and defies common sense. Thank you, Mr. Chairman.
Do I get a reply? Or Senator, you've sat in that chair for how long? 20, 25 years, while the chronic disease in our children went up to 76%. And you said nothing. You never asked the question why it's happening. Why is this happening? Today, for the first time in 20 years, We've learned that infant mortality has increased in our country. It's not because I came in here. It's because of what happened during the Biden administration that we're going to end.
I'm going to let Senator Wyden respond briefly to that, and then we're not going to go over like we just did.
Defend this committee on a bipartisan basis. Colleagues, my cabinet secretary says that we have no interest in chronic care. Mr. Secretary,
Mr. Chairman, could we have regular order, please?
We are in the process of turning around the Medicare program with the chronic care bill that Chairman Hatch, when he was chairman, and this committee put together on a bipartisan basis.
All right, we're going to proceed. And I just want the rest of the members to know, I gave Senator Wyden as ranking member some leeway there, but we're going to stick to the 5 minutes. Senator Grassley.
First of all, thank you. I have asked HH secretaries in the past to fully utilize the Rural Community Hospital Demonstration Program under Medicare. The program has been underutilized. In May, the CMS filled the open slots. Thanks to your agency's work, there's been 10 more rural hospitals in the program. It's important that the federal government uses every tool possible to help rural hospitals, and thank you for making that possible. Now to my questions. Back in January, during your confirmation hearing, you told me that you agreed to leave farming regulations to the Department of Agriculture and EPA. Do you think that any comments you have made since your confirmation on topics dealing with agriculture are consistent with what you said in January, that USDA and EPA ought to be regulating farming, and that the Department of Health and Human Services should not seek to regulate farms, the tools they use, or the markets that they sell into?
Yes, Senator, we are working very, very closely with Brooke Rollins and with the agricultural community. We've met with over 140 farm interests over the past 3 months to incorporate them to make sure that the MAHA agenda is consistent with their agenda. We are producing the best food in America, that we're protecting our soils and our soil microbiome, and that we're protecting all kinds of farmers, including those who want to transition to regenerative agriculture. We're consulting every stakeholder in the farm community in everything that we do.
I just raised the question because farmers in my state have been concerned about some of the things you're saying.
Senator, I can't hear you.
I'm sorry. Some of the farmers in my state have been raising questions about some of the things that they think you said, whether it was out of context or not. I just thought I'd raise this question so that you would keep by what you told us back in January at your confirmation hearing. Now, Senator Durbin and I have a bipartisan bill that requires price disclosures on TV ads. Price transparency is important in drug advertisement. I know that President Trump, Vice President Vance, and you are all supportive of this effort. When can I expect action from this administration on requiring drug companies to publish the price of drugs in their TV ads? And just in case you would tell me that you don't think you have that authority, can you help Senator Durbin and I on our bill so that we can ensure that you have legal authority to require price disclosure?
Senator, I think it would be good for us to talk about this offline. We are working on this in our agency, and I'm happy to give you the details of what we're doing.
Okay. I got a question here on transplant. Senator Kennedy and I have been working it, or Senator Wyden and I have been working on this. For nearly 2 decades, I've engaged in a bipartisan oversight of the organ transplant system. RISA has developed a tool to combat transplant line skipping. I hope that you can take steps to make sure that these steps are being taken by HHS and ERISA to curb transplant line skipping. On July the 2nd, Senator Wyden and I wrote you a letter highlighting cases of OPOs in Mississippi and Kentucky. In each of these cases, OPO allegedly tried to harvest organs from patients still showing signs of life. I expect you to take steps through these organizations to ensure that this doesn't happen again.
We have mounted a major investigation of misconduct, of illegal behavior, of organ harvesting, of living people, of line skipping, of favoritism, of all kinds of scandalous behavior inside the organ procurement organizations. We have already ended the contract, terminated the contract with the sole source provider. We are reorganizing the entire industry so that this can never happen again. I'm happy to go into the details with you if I had more time.
Thank you. Senator Cornyn.
Mr. Secretary, the United States spends approximately 18% of our GDP on health care, and yet by most accounts, we rank roughly 10th in the world in terms of health care outcomes. Our Democratic colleagues seem to think the more money you spend, you're necessarily going to improve those outcomes. But at the same time, we have the two major drivers of our national debt, Social Security and Medicare, while we spend more money on interest on the national debt than we do on defense of the nation, which is an unsustainable trajectory. What is it that you're doing to address the effectiveness and the outcomes of our healthcare expenditures as opposed to just throwing more money at the problem?
Yeah, I mean, throwing money at the problem does not work. We spend 2 to 3 times per capita what European nations spend on healthcare, and we have the worst health outcomes. We're 79th in health outcomes globally. Over the past 20 years, we've lost, or 30 years, we've lost 6 years to Europe in terms of longevity. So our lifespan was even with Europe's, now it's 6 years behind. As I remarked to Chairman Wyden this morning, or Minority Leader Biden, today we got new data that showed that infant mortality has increased in this country in 2024 for the first time in 20 years. Diabetes has gone up 98% in 20 years. Nobody's doing anything about it. CDC's job was to make sure that this didn't happen. And what we're going to do is reorganize CDC, but also we've already righted the ship at NIH, at FDA, at CMS. And we are going to end the chronic disease epidemic. We are devoting thousands of studies. We're going to devote to identifying the causes, and we're eliminating them. And we're already starting. We're not waiting for everything to come in. We are starting now. We're doing this with food dyes, with grass standards, with dietary guidelines. We're going to get better food and better health to the American public because it's chronic disease that is bankrupting us and destroying our national security.
It seems to me one of the biggest problems that we have in America today is the trustworthiness of the information that we actually receive from the news media and from any other source. And obviously, the easiest thing for our Democratic colleagues to do is to scare people because that is a powerful emotion, no matter what the facts may be. Do you believe COVID-19 was politicized?
Yeah, the whole process was politicized. Senator, I mean, we were lied to about everything. We were lied to about natural immunity. We were lied to about, we were told again and again the vaccines would prevent transmission, they prevent infection. It wasn't true. They knew it from the start it wasn't true because that's what the animal studies and the clinical trials showed. We were told that there was science behind cloth masks. the CDC allowed the teachers union to write the order closing our schools, which hurt working people all over the country, and then pretend it was science-based. All of these issues, and then I can show you, like, for example, Chairman Wyden was talking about me politicizing ACIP, but during COVID, probably the most famous scientist on ACIP was Martin Kulldorff from Harvard, the great, world-renowned epidemiologist and vaccinologist. And he criticized the COVID booster mandates. They ejected him from COVID because he wasn't in the orthodoxy. The two biggest health officials at FDA during COVID, Dr. Gruber and Dr. Krause, criticized the Biden mandates, vaccine mandates. You know, President Biden said in August, I would never take that vaccine, the Trump vaccine. And he came in, he mandated it, and then he fired the two top health officials at FDA who said, hey, this thing has not been properly tested. So the whole process was politicized, and even today.
So let me, in 15 seconds, so I think you answered yes. It was politicized. And I have concerns that when you look at some of the conflicts of interest in peer-reviewed articles in professional journals, and when you point out that even some of the physician associations are conflicted because of the money they get from the pharmaceutical industry, are you committed to trying to make sure that we use the best science and separate and eliminate politics as much as possible?
That is what my job is. That's what my mission is. Eliminate the politics from science.
Senator Bennett.
Mr. Secretary, in June, you fired every member. Mr. Secretary, may I have my time back, Mr. Chairman? Thank you. Mr. Secretary, thank you for your attention. In June, you fired every member of the well-qualified panel that was charged with recommending vaccines to the CDC. No one in your job has ever fired every committee member all at once. That month, you told the American people that you were, quote, going to bring great people onto the ACIP panel, not anti-vaxxers. Are you aware that one of the people you put on the panel, Dr. Robert Malone, claimed that the commonly used mRNA vaccine, quote, causes a form of AIDS and can damage children's, quote, brains, their heart, their immune system, and their ability to have children in the future? Yes or no, Mr. Kennedy?
And Dr. Malone is one of the inventors.
Yes or no? Yes or no? Were you aware that he had that view when you appointed him to this panel?
Dr. Malone is one of the inventors. As I said, Dr. Malone is one of the inventors of the mRNA
That's fine. That's not
so he knows a lot more about
statement,
it than I do.
Mr. Chairman, that statement is not true that Dr. Malone made.